Hello and welcome to the Spectrum Health Cardiac Rehab Education Series. My name is Grayson. I am an exercise specialist with Spectrum Health Cardiac Rehab. And in this segment, we will be discussing stress management and we will review what different stressors can look like and healthy mechanisms we can use to cope with these stressors. Stress is how one perceives and reacts to the pressures, changes, challenges, and demands in life. And we have two different types of stress. We have healthy stress, which you could think of as exercise, which helps to promote growth. It provides a challenge for us and it can make life more enjoyable and interesting. But we also have unhealthy stress, which you can think of as worry or anxiety. And unhealthy stress can overwhelm the mind, it can weaken the body, and even dampen the spirit. There are many, many different sources of stress or stressors in our lives. Some of these might affect you more than others, whether it be family, finances, work. It could be personal relationships that are stressing you out, information overload, especially, in a time following a heart surgery, you might be trying to take in all the information around you, and it might just be causing you a lot of stress. The important thing is that we can identify where our stress is coming from so that we can start to manage that stress. Something that you may be experiencing following a heart surgery or a heart event is survivor stress. You have your diagnosis and initial hospitalization, which can be stressful in itself, but following that, you might have limitations with activities that you can do each day, lifestyle changes. Maybe you're not going to work anymore, which can affect your finances, medication changes, many appointments, and you might even be struggling with your self image and how you view yourself following this diagnosis and hospitalization. Not only might you be feeling stressed out following a heart event or a heart procedure, but your family members are likely dealing with their own fears regarding the future and taking on new or more responsibilities during your recovery process. It's normal for family members to feel this way, and it's very important that each of you share with each other how you're feeling and your experiences related to this whole process to help reduce the amount of stress you have regarding these new roles and responsibilities and your thoughts about the future. Stress ultimately stems from our fight or flight response. What happens when we perceive a stressor is our fight or flight response is activated. Now, when this is activated, our heart rate and blood pressure increase, our respiration or our breathing increases, our metabolism increases, our blood platelets activate, our muscles are going to tense up, our circulation, so our blood is going to divert to where our body thinks that we need it the most, and our eyes are going to dilate, so our vision is going to improve and our hearing is going to improve. In the past, when humans were hunting and gathering, this was a very advantageous response because if we perceived a stressor or an immediate threat, our body would activate this fight or flight response so that we can either fight or take flight, right? To run away from the threat. And so our blood is being cooled to our muscles and our hearing and our vision improves so that we can move or we can fight if we have to. However, nowadays we are having the same response to stressors that don't present an immediate threat, such as finances or traffic or personal relationships. So it's important that we can recognize these stressors to reduce the amount of, of response that we're having to these stressors. The fight or flight response long term, if we have continued stressors every day, is going to result in chronic stress related illnesses because we are activating these systems so much. Increased heart rate, increased blood pressure without an immediate threat. This is going to have negative consequences on our health. And so over time, if we experience these chronic stressors, our digestion is going to be impaired, our reproduction could be affected, it's going to limit tissue growth, our immune system is even going to be compromised to some degree, and it can end up causing stress-related illnesses. And stress can play a very big role in heart disease. Throughout the rest of this segment, we are going to expand on different ways that we can manage stress to help reduce the negative consequences that stress is having on our health. And this is going to include self-care, challenging our own perception, making choices, staying connected with people, humor, and letting go. To help manage stress, it's very important that we are aware of ourselves and that we take care of ourselves. Each and every day, and in fact, multiple times throughout each day, you should take some time to quiet your mind and take an inventory of your body, your thoughts, and your emotions. Address any physical symptoms such as pain, fatigue, hunger, or thirst. Emotional symptoms such as loneliness, sadness, or fear, or even spiritual symptoms. Maybe you're feeling disconnected or bitter. Try to just address where these symptoms are coming from so that we can then take that next step to manage these symptoms. Getting adequate amounts of sleep is going to help manage stress tremendously because when we're asleep, that's when our body is resetting for each day. The National Sleep Foundation recommends about 7 to 9 hours each night, and maintaining a consistent sleep to wake pattern is going to help you get to sleep and stay to sleep consistently each night. If you're having troubles getting to sleep, try to avoid napping throughout the day. Ensure that you're getting adequate exposure to sunlight or natural light. When you are going to sleep, create a quiet, relaxing, and comfortable sleep environment and try to associate your bed just with sleep instead of any other distractions such as the television or reading or even being on your phone, because that can affect the quality of the sleep we get each night as well. And again, make sure you're exercising on a regular basis because this is going to help us spend some of that energy and make sure that we're tired in time for bedtime. Some other techniques we can use to improve our quality and quantity of sleep is to avoid stimulating activities prior to going to bed. So if you can, try to avoid any arguments or upsetting thoughts. Avoid eating large meals because a lot of our blood is going to pool to our stomach and help with digestion rather than with our sleep. And try to avoid vigorous exercise too close to bedtime. And again, as well as stimulating activities, we want to try to avoid any stimulating substances. So caffeinated foods and drinks, nicotine, and even alcohol can hinder the quality of sleep that we're getting each night. Another technique we can use to help manage stress is to challenge irrational thoughts. We react based on not what reality is, but what we perceive as reality. So look for the truth in your circumstances. Check others' interpretations. What you heard from your doctor might be different from what your spouse interpreted from your doctor. So make sure to talk and share what you may have interpreted and challenge irrational conclusions. Throughout the next couple of slides, we are going to talk about some irrational beliefs, some beliefs that we should challenge to help us manage our stress. The following 10 common irrational beliefs come from the New Guide to Rational Living, a book by Albert Ellis. And he provides examples of ways that we can think more rationally about the same thing. And I'm going to share a few examples with you throughout this slide and the next slide. For example, number 1, you must have love and approval from all people you find significant. This is irrational because even those who think highly of you will not approve of some behaviors or qualities. This irrational belief is likely the single greatest cause of unhappiness. Another example, number 3, when people act poorly, you should blame them and see them as bad, wicked, or rotten individuals. When really it's true that people may act in ways that you do not approve. It would be better for you if their behavior could be changed, but it's not always likely. And so it's important that we can recognize that not all of these things are rational to believe in, and we need to accept our faults and accept the faults of others as well. One more example that I wanted to share of a common irrational belief that we should address. Number 7 here, it's easier to avoid life's difficulties than to face life's difficulties. When in reality, avoidance exaggerates the anticipated pain of your circumstances. Yes, it might be difficult in the beginning to face that grim reality and to have that self-discipline, but it can be very rewarding. And you might develop skills that make you more efficient and reinforce facing challenges head on so that later on in life, it's easier for you to face and conquer those fears. So it's very important that we can address some of our irrational beliefs to reduce the amount of stress that we have about these beliefs on a day-to-day basis. To manage our stress, it's very likely that we're going to have to make choices and make changes. And change can be stressful, but so can not changing. And stress, although it can have some unhealthy effects on us, it can also prompt positive changes. So ask yourself, do your stressors follow a specific theme? Try to identify this theme and identify different things you can do differently to help reduce this stress, whether it be forgiving others and letting go, setting limits for yourself, getting more involved, and always ask for help if you need it. Staying connected with others is really going to help us with managing our stress. Other people in our lives, not only can they offer encouragement for us to keep progressing, but they can oftentimes offer information and guidance. Many people throughout life experience the same events and stressors that we experience ourselves. And so it's important that we can share with these people and use them as resources to learn and help us progress in our own way. Having a solid support system is very important for managing stress. The Mended Hearts organization is a national organization that offers support and education for patients and their families to help reduce stress and inspire hope for the future. And you can either call the number listed below or visit their website to find those support and educational resources. An excellent technique to help manage stress is just with laughter and finding the humors in life. Laughter can actually reduce levels of stress hormones like cortisol, epinephrine, and growth hormone, and it also increases health enhancing hormones such as endorphins. And actually, there was a study done by Mary Payne Bennett out of Illinois State University that showed that laughter can also help to boost our immune system. So, laughter has many important health benefits. And if you're having trouble trying to find the humors in life, you can try to find a laughter club or join laughter yoga, which can help open you up to some of those humors because openness to humor and laughter in daily life can be affected after going through a heart surgery or a heart event. A study out of the University of Maryland showed that heart patients are 40% less likely to laugh compared to their peers without heart disease. So if you can, try to take yourself a little less seriously. A couple quotes here at the end. He who laughs lasts, and I'm sure you've heard this before. Laughter is the best medicine. So try to find different things, even if it's resorting back to those old comedies that you'd watch growing up. Try to find different ways that you can incorporate that laughter on a day-to-day basis. One approach to managing stress includes spirituality and letting go. There are going to be events and circumstances that happen throughout our lives that we just cannot control. And instead of stressing about these things that we cannot control, it's important that we let go and we trust in the flow of life. And having a reverence to something greater than your personal circumstances can help to strengthen and bolster your spirituality, as well as having fellowship with others and participating in prayer or meditation, and really staying grounded to your goals and your values. To help you identify stressors and ways to cope with these stressors, I would like to do a little activity. David has been exhausted every morning, even after sleeping 10 hours. He is in the process of moving and has decided he is doing so much physical activity that he cannot even exercise. David decides to ask friends and family to help him pack and hires a moving crew for the heavy things. Now I want you to take a minute, rewind the video, pause the video if you have to, take as much time as you need, and just think about which of these techniques did David employ to help manage his stress. David actually did really well with using mechanisms to cope with this stress. He started out with self-awareness and self-care. He was able to recognize the physical symptoms that he was having. He was feeling very exhausted. Not only that, he was able to challenge the perception that he has to do this all on his own, that he must be thoroughly competent, adequate, and achieving. And lastly, he was able to stay connected and make that choice to ask others for help, which is going to help him reduce the amount of stress that he has. Some reading recommendations listed below that are going to relate to stress as well as heart disease, and we encourage you to read, include Thriving with Heart Disease by Wayne Sotil, Prevent, Halt, and Reverse Heart Disease by Joe Piscatella and Barry Franklin, and Heartmates by Rachel Freed. Those are all very resourceful reading recommendations to help manage stress. Lastly, it's important that we stay curious and we remain open to change. A curious person makes a decision to pay attention to and recognize novelty in not only familiar but unfamiliar situations, and you embrace that uncertainty. When you're curious and you're open to change, you can remain flexible and explore both the positive and negative parts of a situation. And this helps to embrace the opportunity to explore, learn, and grow. Having a pet can also be a very good, useful tactic for reducing stress. And Zeke is here with a friendly reminder for us to stay curious. If you have any questions, please make sure to write them down and bring them to your next cardiac rehab session, or you can give us a call at 616-486-6921. Thank you for listening.